Welcome everybody. I am Dr. Manar lecturer of medical parasitology. Today I would like to talk about Nematocera, family Culicidae. This lecture will help you to know taxonomy, morphology, internal anatomy, biology, life cycle, and medical importance of family Culicidae of Nematocera. Let's start with taxonomy. Phylum Arthropoda, subphylum Mandibulata, class Insecta, order Dioptera, suborder Orthorhyncha, which contains two divisions. Nematocera, which contains family Culicidae, Similidae, Cratopoganidae, and Psychodidae. And another division, Brachycera, which contains Tabanidae. Let's start with family Culicidae, divided into two subfamilies, Anopheles and Culicini. The mosquitoes that bite humans and which are the most important vectors of disease belong to the genera Anopheles, Culex, Aedes, and Mansoni. Anopheles can transmit malaria parasites, but also lymphatic filariasis, as Wucheria bancrofti, Brugia malai, and Brugia timori, and some arboviruses. Some Culex species also transmit the microfilariae responsible for bancroftian lymphatic filariasis, as well as many arboviruses, such as the West Nile Japanese encephalitis, St. Louis encephalitis, and Rift Valley arboviruses. The Aedes genus includes important vectors of the viruses responsible for yellow fever, dengue fever, Eastern equine encephalitis, and many other arboviruses. Let's talk about general morphology. The development cycle of mosquitoes includes two phases. First phase, an aquatic phase with the succession of immature stages such as eggs, larvae, and pupae. And second phase is an air phase with the male and female adults. The eggs are ovoid and measure about 0.5 mm. They are laid either on the surface of water as in Anopheles and Culex, or near the surface of water as in Aedes. The eggs may be laid separately as in Anopheles and Aedes, or close together in the form of an egg raft at the time of oviposition as in Culex. The eggs are able to float due to side floats as in Anopheles, or apical floats as in Culex. This picture showing mosquito cycle in water and air. The larvae which emerge from the egg evolve in 4 stages, L1, 2, 3, and 4, intersected with 3 molds, which allow the larvae to grow from 1 mm to 15 mm in a week. And the 4 larval stages have a comparable general morphology. The larva is composed of 3 parts, head, thorax, and abdomen. The 8th abdominal segment is modified, which is called the respiratory segment, with 2 important structures. First one, on the lateral side, is the comb, which is made up of spines and scales of different forms, sizes, and numbers, according to the genus and the species of the mosquito. Second one, on the dorsal face, the spicular apparatus, which is located either directly on the tegument for Anopheles or at the end of a respiratory siphon for Culicidae. This is a useful characteristic with which to differentiate the position of the larvae, as Anopheles larvae without siphon stay parallel to the water surface, whilst Culex or Aedes larvae with a siphon have an oblique angle of suspension to the water surface. For Mansoni, the end of the siphon is modified in a hard organ used to bore plants, and Mansoni larvae don't breathe like other mosquitoes, but attach themselves to the broad leaves and stems of aquatic plants in order to obtain their air supply. This picture showing Anopheles larva and Culex larva. Anopheles larva with palmate hair and parallel to water surface, while Culex larvae has a siphon and attached to the water surface. The pupa's morphology is completely different from that of the larva, consisting of two parts: a prominent cephalothorax equipped with two respiratory trumpets. The pupa doesn't have an oral apparatus as it breathes but doesn't feed, and an abdomen made up of 8 visible segments. The 9th segment is barely visible. The 8th segment carries a pair of swimming paddles. The pupa is quite mobile and dive when distributed. Its lifespan is short, 1 to 2 days. The adult male and female mosquito can easily differentiated by observing the head and the end of the abdomen. The head comprises of 2 compound eyes made up of hundreds of ommatidia and 2 antennae with 15 articles in the male and 16 articles in the female. In the male, there is a great number of large setae, which allows for the easy recognition of the bulbous antenna, whereas the female has pilose antenna. And the oral apparatus is of the sucker type for the male and the biter type for the female, which includes number 1, a labium, folded up in a cutter and finished by 2 labellum. In this gutter, there are 6 piercing stylets, which will penetrate the skin and search for a capillary for the intake of blood. Number 2, upper lip, which serves as the roof of the food channel. And 3, hypothorax, which is connected to salivary glands by the salivary channel and forms the floor of the food channel. And finally, 2 mandibles and 2 maxillae on both sides of this female piercing apparatus. There is a pair of maxillary bulbs, which are as long as the proboscis for Anopheles but shorter than the proboscis for Culicidae. This difference allows for easy differentiation of Anopheles from other mosquitoes. The thorax includes 3 segments: prothorax, mesothorax, and metathorax. Each segment comprises a pair of legs made up of a hip, a trochanter, femur, tibia, and a tarsus, with 5 articles. The last article carries at its end 2 claws, which help the mosquito to hold onto the support. Legs carry more or less colored scales, which are used for mosquito identifications. The second segment, or called wing segment, is the largest and carries a pair of wings with veins and scales, whose form and color are also used for identification. The third segment carries halters, which are used for balance during flight. The morphology of lateral parts of the thorax called parietes, very much used in systematics. And there are two respiratory spiracles on the second and third segments. The dorsal part of the second segment is called scutum, which is prolonged by a scutellum. This is simple and rounded for Anopheles or trilobed for Culicini. And the abdomen is composed of 10 segments, of which 8 are quite visible. Each segment comprises a dorsal chitinized part and ventral chitinized part, connected by a very extensible pleural membrane, which allows for the swelling of the abdomen of the female after a blood meal or the maturation of the ovaries. Segments 9, which called genital segment, and anal segment are quite modified. The genital apparatus on the male is very complicated, and its morphology is used in systematics. Between 12 and 24 hours after the emergence of the adult, the male genital apparatus undergoes a 1801 rotation and becomes ready for mating. The terminalia surrounded a complex penis, which is located on the 10th segment, and the abdomen of the female ends with 2 cercus. About internal anatomy, the internal mosquito anatomy is composed of a digestive tract with the pharynx and its pump, which aspirates the blood, the esophagus, the stomach, and the posterior intestine, which ends in the rectum and the anus. The salivary duct arrive at the lower phase of the pharynx, and the salivary pump allow for excretion of saliva during the bite. The salivary channel is connected to a pair of trilobed salivary glands. If parasites such as Plasmodium are in the mosquito's salivary glands, they are inoculated during the bite. In the female, the genital apparatus is composed of 2 ovaries with many ovules, and their oviducts meet to form an odd oviduct, which arrives at the vagina during maturation. The ovules evolve in 5 stages. The spermatheca, which is a duct that opens in the vagina, is an organ where the spermatozoa inoculated by the male during fecundation are stored. There is 1 spermatheca in the Anopheles female and 2 in the Culicini. Let's talk about biology. According to the species, mosquito larvae can develop in all possible types of habitats: freshwater to brackish one, clean to heavy polluted, stagnant water to running water, natural habitats to man-made one, small habitats to large ones. Information on larval ecology is crucial in order to carry out appropriate vector control programs targeting specific mosquitoes. 3 key elements concern the larvae. Number 1, they feed, so it is possible to use insecticides of ingestion like bacillus. Number 2, they molt, so growth regulators like juvenoids can be used. And 3, they breathe at the water surface, so it is possible to use methods aiming at asphyxiating them, like monolayers oils, for examples. Only females bite to take a blood meal for egg maturation, but males and females feed on flower, nectar from which they get their energy necessary for flight. Fecundation occurs 2 to 3 days after adult emergence, and the female's life is conditioned by the succession of blood meal and the development of the ovaries. This is the Gonotropic Cycle, which starts with unfed female. Then after blood feeding, it becomes half gravid and gravid. This cycle must be known for each species or each situation considered in vector control program, as its duration, conditions, the frequency of contact host mosquito, and the ingestion or transmission of pathogen responsible for the disease considered. After egg laying, the female seeks another blood meal, and the gonotropic cycle repeats itself every 2 to 3 days. In tropical regions, the blood meal is accompanied by a maturation of ovaries. On the other hand, in temperate regions, during a cold period, there can be a trophogenic dissociation, for which the blood meal is not followed by the development of the ovary. The females can even enter into complete dispose, allowing hibernation. And the mosquito can take their blood meal from humans or animals or both. And the trophic preferences of species are very important to know. The more anthropophilic a mosquito, the higher its Victoria rule. The blood meal can be taken indoors or outside. And some species bite essentially during the night, like Anopheles, others during the day, like Aedes, and others during the morning or sundown. After the blood meal, the mosquito have a phase of digestion, which lasts about 48 hours, during which they reset either indoors or outdoors. All these behaviors are very important to know in the definition of vector control strategies. It is clear that indoor spraying with remnant insecticides will be efficient. But effects against the exophagic and exophilic mosquitoes will be quite reduced, and the addition of insecticide could even increase exophilic behavior and greatly reduce the impact. And mosquitoes have a lifespan of about 1 month in tropical area. Also, in temperate area, mosquito can survive during the winter in diapause or semi-diapause. Their range of active flight is generally rather weak, 3 kilometers for Anopheles and Aedes hardly move away from their larval habitat, so vector control can target areas near breeding sites. And the mosquitoes can, however, be transported by the wind and by modern means of transportation. Cases can occur as a result of Anopheles vectors traveling by plane from an endemic zone into a malaria-free area and inoculating Plasmodium parasites. Let's talk about subfamily Culicini. Includes 33 genera. The most important one in medical entomology are Culex, Aedes, Mansoni, Aedes, Culex, and Mansoni are found in the temperate and tropical regions. The genera Sepsis and Hemagogas are found only in Central and South America. Culicini are easily distinguishable from Anopheles at the larval and adult stages. And this table showing the differences between subfamily Anophelini and Culicini. Let's talk about species. Number 1, Culex species. The eggs brown, long, and cylindrical are deposited on the surface of water and bound to form a raft composed of some 300 eggs, laid in a large variety of aquatic habitats: small puddles, pools, permanent or temporary ponds, flooded marshes, burrow pits, and even switch drains with polluted water. The most important species is Culex quinquefasciatus or Culex bibinis. Transmission of pathogens by Culex species. Number 1, Culex quinquefasciatus or bibinis has an nocturnal activity with an endophilic tendency. It is the main vector of lymphatic filariasis in urban settings in tropical regions throughout the world, while this parasite is transmitted by Anopheles in rural areas and Aedes in most Pacific islands. 2. Culex vigini is an important vector of Japanese encephalitis in India and develops in clear water in particular rice plantations, but also fish farm basins where manures are added. 3. Many other arboviruses such as West Nile are transmitted by species of Culex bibinis complex in the USA and Culex cereri in Africa, Culex modestus and molestus in the western and eastern zones of Mediterranean basin, and Culex vigini in India. Four, the virus of St. Louis encephalitis is also transmitted by species of Culex bibinis in the USA. The Marivari encephalitis virus is also transmitted by various Culex species. Number 5, the Rift Valley fever is transmitted by Culex bibinis in Egypt and other Culicidae elsewhere. And 6, bird malaria. Let's talk about Aedes species. The eggs, generally black and ovoid, are laid separately on a wet substrate. The eggs are resistant to desiccation for several months. Then when they are covered with water, the eggs hatch quickly. Many larvae develop in small temporary habitats like tree holes and crab holes. Their ability to develop in a large variety of habitats with both fresh water and brackish one and to resist desiccation confers great advantage on Aedes mosquito in terms of adaptation and colonization of new sites. In addition, as the larvae develop in water containers reserved for drinking, it is necessary to pay great attention in the choice of larvicides employed, and the majority of Aedes adults have a particular and quite visible ornamentation of white and black scales on the thorax and legs, which often allows for their rapid identification. Aedes albopictus has a characteristic black and white scale strips at the origin of his name, tiger mosquito, as well as a central line of white scales on the thorax. Aedes aegypti has a characteristic shape of white scales drawing layer on the thorax. The normal duration of the cycle, egg to adult, is from 1 week to 10 to 12 days. Aedes tend to be a rural insect, except Aegypti, which is an urban mosquito that reproduces in all domestic and pre-domestic containers. It bites only during the day, with a peak of activity in the early morning and at sundown. Their behavior is especially exophagic and exophilic, hence the use of insecticides indoor spraying for adult control is insufficient. Transmission of pathogens by Aedes. Number 1. Transmit yellow fever virus, which is caused by alpha virus of family Flaviviridae and transmitted by Aedes aegypti. Shows acute symptoms including fever, chills, vomiting, nausea, muscle pain, and headache. There is no antiviral drug therapy or treatment available for yellow fever to date. However, vaccines have been effectively used to immunize people against yellow fever. Prevention that includes the use of insect repellents and proper clothing to prevent mosquitoes from biting, breeding habitat source reduction, and air spraying for adults has been shown to manage its epidemics. And emerging novel technologies such as trial insect techniques using genetically modified mosquito and Wolbachia-based sterilization techniques. Number 2. Aedes transmit dengue fever caused by RNA virus belonging to the genus Flavivirus, transmitted only to human by Aedes mosquito mainly, Aedes aegypti and Aedes albopictus. Dengue causes fever, chills, retroocular pain, photophobia, muscle and joint pain, nausea, vomiting, and sore throat. It also causes acute and benign febrile diseases. And there is no effective antiviral drug therapy or approved vaccine available for dengue. Vector control, which includes the use of personal protective measures, breeding habitat source reduction, education, and spraying for adults, has been the primary method of dengue prevention. And the emerging vector control technologies, such as trial insect techniques, using genetically modified mosquito and Wolbachia-based biological control, are promising strategies. After yellow fever and dengue fever, Aedes transmit viral encephalitis, and Zika virus. Zika virus of the Flavivirus genus, family Flaviviridae, and transmitted by Aedes mosquito as Aedes aegypti and Aedes africans. The majority of people, about 80% who have Zika virus, don't develop symptoms, but some develop symptoms of fever, rash, muscle and joint pain, and headache that lasts 2 to 7 days. Zika has also been associated with Guillain-Barré syndrome, a neurological disorder in which the part of peripheral nervous system is attacked by its body immune system. Also, Aedes transmit filariasis as well as which is also vector of Brugia filariasis. Aedes togoi. Some Mansoni species are of medical importance. Mansoni uniformis is a vector of lymphatic filariasis agent, such as Brugia malai in India and Wisheria bancrofti in Asia and New Guinea. Also Mansoni vectors of Wisheria bancrofti in Asia and the tropical Americans, and are vectors of Brugia malai in India. In Africa, Mansoni transmit arboviruses and Rift Valley fever. Let's talk about subfamily Anophelini. The adults are night biters, although some species can bite during the daytime in forests or when cloudy. Their behavior can be anthropophilic, endophagic, or exophagic, endophilic or exophilic. The biting activity is important to know in order to establish appropriate vector control methods. Transmission of pathogens by Anopheles. Number 1, malaria. Efficient malaria vector because number 1, feed in human blood. 2, have adequate plasmodium number to maintain transmission. 3, susceptible to gametocyte development. And 4, live long enough. Infected female Anopheles mosquito transmit malaria by injecting with their salivary secretion the sporozoites. Anopheles gambi, a famous malaria transmitter in the tropics, breed in any type of water. Number 2, also Anopheles transmit Wisheria bancrofti and Brugia malai. 3, they transmit viral encephalitis, Western, Eastern, and Venezuelan equine encephalitis, belonging to genus Alpha virus, and the symptoms of infection range from mild flu-like illness to encephalitis, coma, or death. And these are references if you want to have a look. Hoping that the lecture was useful for you all. Thanks and goodbye.